Hello, this is Dr. Tom coming back to you again about the HCG diet. And I know that last time that I had talked about the use of the gastric bypass and bariatric surgery for the management of obesity, and I was actually inspired today because of what I had seen today in patients, people who had actually had surgery in the past. Let me give you a scenario of somebody who has gastric bypass surgery. They weigh over 400 pounds. They go in, they have the gastric bypass surgery. They successfully lose 150 pounds over about a 2-year period of time. However, they have one of those complications. Now, one of these complications that our medical community has decided is acceptable, that it's still safe and effective and more cost effective than non-operative management of obesity, the first thing that people think is, oh gosh, this complication must be sepsis. Maybe somebody is so infected they're in the intensive care unit and they're dying. Or they die from the procedure. Or they have some type of physiological process that puts them in danger. That's what everybody looks at as being a complication. Let's pick something simpler. How about a hernia that can happen in the abdominal wall after the surgery? And a patient had a hernia, had a recurrence of this hernia, and had 4 subsequent repairs from 2006 through 2011. And because of these hernias and the multiple surgeries, this person who lost 150 pounds gained back everything but about 40 pounds because of the hernias, which is a complication. This is just a small example of the possible complications that you can have from bariatric surgery. And the only reason I even bring up this point is that, being a surgeon, I do understand that there are a certain number of complications, there are side effects of any type of, whether it's a medication or a surgical procedure. However, to say that a procedure that can cause death, that can have these type of consequences, and we know that even with the gastric bypass, people can gain weight back, why is the HCG diet, in the eyes of the medical community, such a horrible alternative to doing bariatric surgery? That's the thing that absolutely amazed me, and keep this in mind. HCG has never been shown to cause harm in people, and the use of this diet ever been shown to cause harm, and has certainly never killed anyone.